Welcome to the EADVpodcast. In today's episode, let's take a deep dive into a delicate topic: the psychological challenges associated with skin conditions in young patients. Join Dr. Sarah Walsh and Dr. Tess McPherson, past president of the British Society for Paediatric and Adolescent Dermatology, who have established an award-winning service integrating clinical and psychological aspects of care for young people. But before we get into it,
abstract submissions for the EADV Congress taking place in Paris this September are now open. This is your opportunity to shape the future of global medicine by showcasing your research to an international audience of colleagues, thought leaders, and industry experts. Don't miss your chance to contribute to this prestigious event. Submit your abstract by the 17th of April 2025. For full details, visit EADV.org.
tune in to learn how to better support and understand young patients.
Hello and welcome to this edition of the EADV podcast. I'm absolutely delighted to be joined today by Dr. Tess McPherson, who is a consultant dermatologist here in the UK. She's also the past president of the British Society for Paediatric and Adolescent Dermatology. And Tess McPherson's clinical and research work focuses on young people with skin conditions. And in Oxford, where she works, she has established an award-winning service which integrates both clinical and psychological aspects of care for young people. Now, Tess is the author of a book, which is a book which explains skin conditions to young people. And it's a practical guide on how to be comfortable in your skin. And she was kind enough to give me a copy of this book a couple of years ago. And I have found it to be practice changing in its contents, in the way that it has really helped me to communicate the nuance of skin disease in my consultations with young people. And specifically, it's helped me to address things that I probably overlooked in the past. Dr. McPherson is resolutely patient-focused in her work and has written a number of nationally important guidelines in the UK on topics ranging from scabies to the psychological impact of isotretinoin to the management of SJS/TEN in paediatric patients. But I'm welcoming her here today to have a chat really about bullying and the psychological impact of living with a skin disease. So welcome to the EADV podcast, Tess. It's lovely for you to have joined me today. I wonder if I could ask by asking you to briefly describe to the listeners your training and your early career in dermatology and what first attracted you to working with young people within the field of dermatology.
So firstly, thank you so much for having me, Sarah. It's lovely to be here. So in terms of my background, I trained in medicine in Cambridge and then London, and then did various jobs. In the UK, you do a kind of medical training before you specialise in dermatology. And a job I did, which I think really I've held with me throughout my career, I worked on a teenage cancer unit in one of the London hospitals. And this was one of the first specialties that was really seeing young people, seeing adolescents as having individual, separate medical issues from paediatrics and adults. And prior to this, young people with cancer would either be on a children's ward, which obviously sometimes felt really uncomfortable, or they'd be with much older adults. So this specialist service and the consultant that ran it, I was completely sort of inspired by that. And then I think I sort of took that with me. And when I was first starting out in dermatology, I saw again that this wasn't an age group that we served well. And even though we had lots of evidence that they had huge impact from skin conditions, and we also know it's a time of lots of skin issues. And it's a time when, obviously acne is something we know teenagers suffer with, but conditions like psoriasis and hidradenitis can often start in this age group and have this huge impact. So it became something I really wanted to address when I became a consultant, and that's why I set up a clinic specifically for this age group and specifically to have open access to psychological support, so that we weren't just managing the skin, but we were attempting to have a holistic management of the impact as well, in particular psychological impact.
Yeah, seeing the whole person, which of course is a bit of a challenge in the limited time that we have in consultations. And are there is there a clinical case or cases that stayed with you from your days as a registrar resident in dermatology that sort of reinforced this ambition to work with young people as a focus in your professional career?
Yeah, absolutely. I mean, actually, it was an older person that I think really made me realise the value of supporting young people. So it was a man in his 40s, and he had had psoriasis. And in fact, his psoriasis had been well managed for some years. But we were talking about his life, and he was not with anyone at the time. And I remember asking him something about his relationships. And he said, "Who would want to be with me?" And then he talked about this life he'd had where he could see that he had just not been able to live a life. He felt unable to date, have intimate relationships. And, he was sort of in so many ways seemed like quite a successful person, but he had this sort of deep, he'd never been able to sort of share his life or particularly his body with anybody else. And at the same time, there was some really good work that came out that was published in the EADV actually on the kind of cumulative life impact of skin conditions, such as psoriasis. And I suppose I really thought, gosh, this is a time, and the time of adolescence as well. At this time, there was a lot about kind of brain development. So I think I just sort of thought this would be just such an important moment to support people to hopefully have a kind of much bigger ripple effect on their whole lives, so that they can find some way to feel supported and live with their skin disease and find sort of solutions to some of the problems that this man had never found.
Yeah, so it was almost as a result of seeing the absence of that tailored care that prompted you to see that gap and try and fill it, which is very interesting. And as sort of as a starting point for today's discussion, which I'm sure could lead us in lots of different directions, we both looked at an article from the JEADV, which was published recently, entitled "Bullying in People with Skin Disease," first author Pavel Chernyshov, and it was a report of a study conducted by the EADV Task Force on Quality of Life and Patient-Oriented Outcomes. And I was really struck in this study by the rates of bullying reported in children as young as 3 or 4 years of age. And did you find that these rates of bullying, I think it was probably a third of people reporting it, did that resonate with your own clinical experience?
I think yes and no, is what I'm going to say. I think we know that bullying's complex, and self-reported bullying as well is a measurement, and it's kind of quite hard to really measure bullying. I think this was looking at patients with skin conditions, but we do know that patients of all ages report bullying for all sorts of different reasons. So I think it's sort of how we take this and what we do with it that feels important. It's really important to recognize when bullying is happening for whatever reason, because bullying has such a big effect on an individual. And working with one of my sort of pediatric and adolescent psychiatrists, she's saying that bullying has such a big impact on all kind of poor psychological outcomes, anxiety, mood, obviously feeling like life's not worth living, all these things. So it's really important to recognize it. It's really important to identify it. I suppose the no part is that I do see a lot of people and parents actually almost expect bullying before it's happened. And the line, and you'll probably be familiar with this, Sarah, I don't want them to get bullied, like almost as if by managing a skin condition, you can stop bullying, if only it was that simple. And on the flip side of that almost if bullying is seen as something associated with the skin conditions, if we take the wrong sort of conclusion from that, we start to think, well, if only they didn't have a skin condition, they wouldn't get bullied, or the way to manage it was maybe with treating things that don't need treatment and would be better managed by support. So yes, I think it's really sort of shocking data in some ways, but we know that bullying is or reported bullying, or people's concern about bullying, is absolutely high, and particularly in adolescents. One of the things they really worry about, there are two things they really worry about, is their appearance, which is obviously skin comes into that, and bullying, or being ostracized, or being cancelled, or being socially isolated. Those things are major concerns, but then it's sort of how we support people to deal with those concerns, or to deal with bullying when and if it happens.
Yeah. And actually, that was one of the things I find most helpful in your book, actually, because you've got a section at the back about living with skin disease, which incorporates, comment on bullying and perhaps how to respond to that when exposed to it. And I think you're right. I think this bullying is this incredibly complex issue. And as such, I guess this was a very difficult study to conduct methodologically, and there's a lot of skin conditions contained in it, some of which one would expect to have a more or less impact on visible difference. But as you say, the visible difference is only one aspect of that And I'm sure that having a skin disease can perhaps lead to behaviours that might be recognised by bullies, and
or even expectations of people's behaviours or misinterpretation of people's interests or comments. And I think that's, again, that can be quite sort of variable across different ages. I mean, I think you said as a visible difference, yes, but there's lots of different visible things which people can be teased for or made aware of, hair colour, skin colour, all these things. And I think it's sort of how skin conditions play a role in that. And I guess what I see particularly is that a lot of my patients, the biggest critic is not other people, it's themselves. And that's why supporting them is so vital. I mean, there was, again, very near when I was sort of junior in dermatology, there was a very, very sad case that was in the media of a girl that had gone online to ask for support for facial eczema in her adolescence, and had received all these horrible messages, you're ugly, you shouldn't be here, and very, very sadly took her life, completed suicide. But when they actually looked into it, the really sad twist to this sort of tragedy was that nearly all the messages, if not all the messages, had been written by herself. So, I mean, a very stark example of a sort of huge feeling of self-criticism rather than other people being unkind. And I think the self-critic, and we're seeing that now in some work we do on sex and intimacy, is the self-critic is often much louder and much more problematic than what other people are saying or doing. But so not to take it seriously, and to not do the really important work that EADV are doing on public education, because ignorance is a big driver for comments, careless,
huge, and misinformation. And you reference the social media, which I think has had a significant role in propagating misinformation on things like eczema, and the fact that there's this huge misconception that a lot of skin diseases are due to being unclean or unhygienic, which of course is, as we know as dermatologists, is utterly untrue. Yes. But making sure that people understand that. I mean, that's one of the pieces of work that the EADV is very, very keen on doing.
And stating that, because people, even if they laugh when you say that you haven't got spots or acne because you're dirty, they'll kind of, it's really just not your fault. Those are such important things for dermatologists to transmit to patients, so they can at least start to develop some sort of inner messaging, some sort of inner confidence that can quiet people that are saying stupid things.
Yeah. And practicing that dialogue, I guess, a little bit in advance, because you've got this great page in your book where you talk about suggested responses when people say things like that, which I think is really, really helpful, because often you have to rehearse these responses a little bit, don't you?
Yeah, and sometimes it's really boring. You don't want to have to tell people about your skin, but it's working out how that affects you and how those comments, which maybe there's some of those are inevitable to a degree, but I think that people can misinterpret or mishear them as rude sometimes, and that's why it's quite difficult to know when these reports of bullying what they were actually reporting.
I mean, one of the things I was also struck by in the study was the fact that of the people who made someone else aware of bullying, about 40% took no action on the young person's part. And I mean, I guess this, may again be a slightly higher percentage based on what you just said about the interpretation of bullying and what constitutes bullying. But do you think there is an inertia on the part of parents, teachers, adults interacting with young people to act on this sort of bullying? And what are the barriers, to addressing bullying in the context of skin disease?
I think there is. I think people don't often know what to do, and there's, in some of the cases I've managed, there's a sort of inertia or a feeling that there's not much that can be done, or there's a sort of, and I think schools can often be behind the curve, and I think social media is probably, and I know lockdown has caused so many issues with young people, across so many countries. I think they don't always know how to handle it, and there may be lip service to it. There may be an anti-bullying policy, but actually, when faced with it, it's quite difficult, depending on what the bullying is and how it's happening, for people to seek support, and B, definitely from this, as this article showed, get support, and how that's done. And I guess some schools, some countries do it much better, and it's having a kind of full package where whatever institution you're in, there isn't bullying, for instance, in the staff room or within the other people. So you have to have a kind of whole package of recognizing bullying, calling it out at all levels, and and
have a culture where speaking out is sort of encouraged and fostered. And I mean, I think the other thing is even getting it out there in the first place, because the other thing this study commented on was that only a third of patients with skin disease had spoken to somebody about the fact of being bullied. And for me, this begs the question as to whether or not clinicians are missing opportunities to open this discussion. And, this is another really important piece of work that you have been involved in, Tess, which is establishing guidance on the assessment and support of mental health in children and young people with skin complaints. This is a fantastic piece of guidance. And in it, I know that a study conducted by an eczema charity demonstrated that 90% of children and young people would like to be asked about their mental health in clinic. And this might not be something that people necessarily feel comfortable doing. And what advice would you have for our listeners about how to integrate this into your day-to-day clinical practice?
Yeah, so I think hopefully read the guidance. It's hopefully a pragmatic toolkit for all people, not just dermatologists managing children and young people with skin conditions. I think one of the interesting points you just raised was that we felt when we went into this piece of work, which I did with the British Society of Paediatric and Adolescent Dermatology, and particularly with a woman called Jane Ravenscroft, we thought we were kind of going to be identifying the right patient-reported outcome measure that would pick up the right things in the right way. But actually, we kind of almost did a about turn with all the work we did and with the patients we spoke to, because they were doing lots of proms already, if they were doing them, they often felt they were tick box exercise and people weren't acting on them. So yes, it can be useful to have quality of life measure or mental health measure, but the thing that patients really wanted was just to be asked, just to have it acknowledged that this was going to have an impact, and not that they weren't asking for formal psychological support, although that might be needed in some cases. They were asking for their dermatologist or their health worker to be kind, to say, how's this impacting you? Is this stopping you doing things? How are you feeling about your skin? And these are questions which don't take long, and they can really open up a narrative, or reassuring. Often when people will say, well, I just find it really annoying, I'll think, well, it is annoying. It is annoying to have acne. And that can almost be kind of like reassuring in terms of where their kind of mental state is with their skin. But asking them, we know, and even asking about conditions like, or asking whether they feel like life sometimes isn't worth living. These questions make people feel supported. They're not dangerous. They're not opening dangerous cans of worms. And I think that's, again, probably like you said, it's practicing doing these things, realizing how much more you get out of your consultations when you do them. It doesn't take that much longer. It makes people feel supported, and it makes you feel like a better dermatologist and get a better rapport really quite quickly.
Mm-hmm. And I sometimes think young people use the word, the adjective annoying, because it feels like a word they can use without seeming vulnerable. And it probably means different things in different contexts, because you're right, they do use that word a lot. And I think if you do a questionnaire before the patient comes into the room, I think that is actually a useful inroad for you. So it's kind of, you've got a starting point for the discussion, but the patient has highlighted something on a piece of paper, which might be an easier way to raise the issue for them, and it gives you an entry point for the discussion. Is that something you have in your practice? They fill in something before they come in to see you?
Yeah, we do this sort of general question. I use, for the teenagers, I use the teenage quality of life, which I think has really, has quite a lot of sort of psychologically minded questions. We did also pilot a thing which we do use, You and Your Skin, which has just got a few questions, which is supposed to be, it's not scored, it's a conversation opener. And we found, again, that can be a really useful way to highlight concerns when you start the consultation and to try and talk about the things that are important to a patient. And it's just kind of getting that combination, which I think working with a psychologist, I've learned over the years of managing the skin. That's a key importance. People come there to get their skin managed, but also recognizing what maybe doesn't need to be managed and how the impact is playing a role and what can be done in that part.
Mm-hmm. And I mean, just continuing on the theme of communication, I mean, this paper that we both looked at had some really heartbreaking first-person testimony, quotes from patients about their experiences of bullying from children, as young as 9. But what shocked me was that some of the quotes related to comments from healthcare professionals, sort of insensitive throwaway comments that clearly had a deep and painful impact on the patient. Did that surprise you? Some of the comments that were reported to have been spoken by healthcare professionals?
No, unfortunately not. I thought the really interesting things, which again chimes with my practice, was there was a lot of comments from parents about acne, a lot of judgment from parents that they were either not eating well, lazy, picking their spots, these sorts of things. I hear a lot from parents. They can't help but sort of pass this judgment, which again, we know is not based on fact to children and young people. So I try and quash that. But in terms of the health workers, I mean, I think sadly, I did some work, you probably remember with the Eczema Outreach Society, we did some work with the young panel and did a presentation to the BAD National Conference. And some of their testimonies were absolutely shocking. They were waited months to see a dermatologist with their eczema. They would go in and someone would say, it's not that bad, and, discharge them. And so those kinds of experiences, just talking about sort of, standing in a car park with data on getting patch testing, just sobbing because no one had, they were just being sort of told it wasn't that bad or just given something very dismissive. And that's, it was extraordinary to hear some of the experiences they'd had, which again really drove the hopefully useful guidance to just to take it seriously and just to see people as not just a skin condition or piece of skin. And I think again, sometimes that is how they feel. They do feel like people are just seeing them as a lump of psoriasis or a case of acne rather than as a whole person.
Yeah. And so, making sure that they feel heard. And, as you said earlier, I mean, the EADV has sort of been trying to do a bit of work on this in the context at sort of European level. And we've got an advocacy team. And one of the aspects that we focused on when we prepared the call to action on skin disease, which was published last October and presented at the European Parliament. One of those focused on reducing stigma, which I guess is a huge part of this. And we touched on it earlier, but do you think there is a role for funding education programs, let's say for school-age children, young people, where we provide education on things like eczema, like things like acne, so that children and young people are aware what causes it, that it's not contagious, it's not infectious, no link to inadequate hygiene. Do you think these sorts of education programs could make a difference in this context?
I think what the EADV is doing is absolutely brilliant, because that's where it starts, doesn't it? By people understanding. And I think some conditions there is better understanding, though. For instance, alopecia, people used to just assume they were having cancer treatment. I think that is now much better understood, partly from sort of social media, that there is a condition where you lose your hair, but you're not having treatment for anything else. But I think a lot of the hidden conditions, I think psoriasis, you must hear patients that are still told in a swimming pool that it's, even now, what have they got? They can't be there. So just that these conditions happen, that they're nobody's fault, that they're not contagious, that sort of education and that sort of knowledge would just hopefully address some of the ignorance which leads to stigmatization and rude comments and potentially bullying. So I think absolutely, I'm trying to do some work with secondary schools at the moment, but I think what the EADV is doing in a sort of more holistic way is super important, and we should all get on board.
Yeah, we've got a long way to go. We just had a change of the European Parliament, so we're trying to keep the pressure up to get some of these things going. And finally, I guess I always like to leave these podcasts with a little kind of clinical tip or practical help for the listeners. And as I mentioned earlier, I found your book so fantastic for communicating ideas to patients. What sort of top communication tips would you have for listeners who are having consultations with young people? And I guess I want to ask specifically parents in the room, parents not in the room, and how to most effectively communicate with a reticent teenager.
Yeah, and it can seem difficult, but as I said, I feel like it's a complete honor to manage young people, watching them grow old and watching them become more comfortable in their skins, and the change that sort of psychology happens is just such an honor. So I would, first of all, do not see it as difficult. Young people are there to be communicated with. I suppose a few top tips, just remembering that this appointment may be a big deal for them, even if it does look like their parents have dragged them in. Ideally, see them on their own, and then if you can with their parent, but at least give them the option to be seen on their own. That's super important. Number one is ask them what they like to be called, because that as well has got me out of lots of trouble. So the name on there that you call them in as, that might not be the name they identify, and they might identify as a different gender. Just get the name right, and then document that. Often I find I almost do the history backwards. So I'll often start with, okay, nice to meet you. What are you up to at the moment? Are you at college? So you have something and document it, because when they come back again, something about them. It doesn't have to be ages. They don't want to have a long, they don't want to disclose too much, but you ask them something simple, some closed questions, just to kind of get you into their life and kind of understand them a little bit, who they're living with at home. Have they got, well, sometimes come to the end, when I ask who they're living with, I often document their pets' names as well, depending on the age. Really useful to have their pets' names documented. If you remember the name of their dog, you're in for many people. Document which football team they support. These things are really useful. They're not massive, and they just, if you get them on your letters, then they just make you remember that person, and you can kind of get straight back into managing them. And then you get onto to the skin. And then when you've talked about the skin, you do ask the questions about the impact. And honestly, it doesn't take that long. It just means that you have, a system which you get someone on board, you get them talking, you get them hopefully giving you the information that they want to give you, and they don't leave that appointment feeling that they haven't been heard.
Yeah. So see the whole person and make sure they understand that you see them as an individual. I mean, that's absolutely fantastic, Tess. I think all of our listeners will have learned a huge amount from listening today. And I'm really grateful to you for taking the time to record with me. And I wish our listeners an enjoyable rest of the day. Thank you.
Thank you so much, Sarah. Thank you.
We would like to give a special thank you to all our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews, research, and other topics of merit. Until the next episode, take care of your skin.